The first 2018 edition of AJP-Heart and Circulatory Physiology video table of contents or from the editor's desk. We certainly hope you've had a great holiday season and now are hard at work planning your next studies. To help, we've assembled a great lineup of papers this month, including 2 editorial focus pieces and 13 original research papers. As I mentioned last month, we have a newly designed website which has added value compared to just searching PubMed. So check it out and let's dive in. Haley et al. Aimed to assess the acute effects of moderate and high-intensity exercise on endothelial function as assessed by flow-mediated dilation in aortic aneurysm patients and healthy adults. Participants undertook 3 randomized visits, including moderate intensity continuous exercise, higher intensity interval exercise, and no exercise control. Baseline forearm-mediated dilation was lower in aortic aneurysm patients than in healthy adults. There was no group differences in forearm-mediated dilation responses after each condition. Forearm-mediated dilation did not change after no exercise control, but increased 10 minutes after moderate intensity continuous exercise in both groups and returned to baseline after 60 minutes. Conversely, forearm-mediated dilation decreased 10 minutes after higher intensity interval exercise in both groups and remained decreased after 60 minutes. They found that the acute response of endothelial function to exercise is intensity dependent and similar between aortic aneurysm patients and healthy adults. Improved forearm-mediated dilation after moderate intensity exercise may provide short-term benefit. Durham et al. Assessed whether increased HDL levels protect against doxorubicin-induced cardiotoxicity in vivo and in cardiomyocytes in culture, and explored the intracellular signaling mechanisms involved, particularly the role of scavenger receptor class B type 1. Transgenic mice with increased HDL levels through overexpression of human apolipoprotein A1 and wild-type mice with normal HDL levels were treated repeatedly with doxorubicin. After treatment, the ApoA1 wild-type mice displayed cardiac dysfunction and increased cardiomyocyte apoptosis after doxorubicin. In contrast, ApoA1 transgenic mice were protected against doxorubicin-induced cardiac dysfunction and cardiomyocyte atrophy and apoptosis. Hyperglycemia-induced production of endothelin-1 is a hallmark of endothelial dysfunction in diabetes. Padilla et al. Show that adapter molecule TRAF3 interacting protein 2 mediates high glucose-induced endothelin-1 production in endothelial cells and endothelin-1 mediated endothelial cell inflammation. Specifically, they found that high glucose upregulated TRAF3-IP2 in human aortic endothelial cells, which subsequently led to activation of JNK and IKK beta. shRNA mediated silencing of TRAF3-P2, JNK1, or IKK beta abrogated high glucose-induced endothelin converting enzyme 1 expression and endothelin 1 production. Kuzmarsky et al. Tested the hypothesis that a chronic deficit in muscle blood flow capacity would be sufficient to trigger an exaggerated pressor response to dynamic exercise. Sprague-Dawley rats, 5 male and 5 female, were instrumented with radiotelemetry devices to measure the cardiovascular responses to treadmill running before and after bilateral femoral artery ligation, which has been previously shown to reduce the blood flow capacity of distal limb muscles by greater than 50%. Treadmill running evoked reproducible increases in mean arterial pressure and heart rate, which were significantly augmented 3 days after femoral artery ligation in both male rats and female rats. Similar exaggerated mean arterial pressure and heart rate responses were observed at repeated intervals between 3 and 65 days post-ligation. These findings indicate that a chronic deficit in muscle blood flow capacity is an important persistent cause of the abnormal pressor and cardioaccelerator responses to dynamic exercise in both male and female rats. Finally, Francois et al. Sought to examine the effect of blunting postprandial hyperglycemia by following a low-carbohydrate diet with or without post-meal walking exercise, are markers of vascular health in type 2 diabetes. In a randomized crossover design, individuals with type 2 diabetes completed 3 4-day controlled diet interventions consisting of low carbohydrate diet alone, low carbohydrate diet with 15-minute post-meal walks, low fat controlled diet, and, and fasting. Blood samples and brachial artery flow were measured before and after each intervention. Total circulating microparticles, endothelial microparticles, platelet microparticles, monocyte platelet aggregates, and adhesion molecules were assessed as biomarkers of vascular health. The conclusions are that attenuating postprandial hyperglycemic excursions using a low carbohydrate diet combined with post-meal walking appears to be an effective strategy to improve endothelial function in individuals with type 2 diabetes. Watching this month's edition of From the Editor's Desk. As you continue to read AJP Heart and Circulatory Physiology, look for 3 upcoming guidelines articles to be published in the next couple of months. You can find them now in Articles in Press. We'll see you next month. If you're in the Northern Hemisphere, please stay warm and send us your best work now.